bus looks like. What we have out here is a bus that in 2012 the good volunteers of Occupy Medical put together a grant and found this old bloodmobile, and we have retrofitted it to turn it into a free clinic. We have unfortunately since kind of grown out of it a bit because there's just so much need, but the bus is still in use every single week. So we're gonna go inside and I'm gonna show you a little bit on the inside. We are an integrated clinic and we do use herbs, and right now what we do is we are using the bus as primarily the herbal part of our clinic. So we're gonna go here inside the magical bus, and you can see right there, that's a bench that the patients come and sit down once they've already gone through triage and talk to the doctor, talk to the nurse, had a chance to get a little something to eat. We have a lot of malnutrition that we see on our bus, and our patients suffer mightily from it. So that's why we choose to offer so much food for 150 to 200 folks. And we also have hygiene products that we give away, toothbrushes and tampons and soap and shampoo. And one of the biggest things that we give away is socks. When you're dealing with the unhoused, and about 50% of the population that we serve is unhoused, then you end up giving a lot of socks because those are gold. People that have to stay on their feet all the time have a lot of foot issues. Unfortunately, in our society right now and where we are, it is illegal to sleep or rest in public, particularly if you're poor. So that's why the foot problems are so abundant. Now, behind me you could see just some of the resources that we have there, and some of them are resources that are just for the clients that we give away so that they know how to get the resources that they need. And right here is just a few of the supplements that we give away. Everything we have is donated. We have donations from Mountain Rose and Natural Grocers and Carlson Labs and Evergreen Nutrition, and people really want this community to have the health care that they need, and it's so great to have offer for folks that can't afford natural nutrition. The unfortunate thing is that right now herbal medicine is still not accessible to those that need it the most. They are in desperate need for herbal medicine and for supplements, and they just can't afford it. So this is one of the ways that we help our community get healthier. And some people have asked me, well, what's your favorite herb and the way that you like to dispense the herb that you particularly like? And that's, although it's kind for people to ask, really when it comes down to it, my favorite herb and the way that my favorite is to dispense it is the herb that is best for the patient and is going to increase their compliance. Now, some obvious stuff is we have a huge variety of different herbs here. Some of them are capsules, some of them are tinctures, some of them are syrups, some of them are in essential oils. It's just a vast variety here. And one of the reasons why we have such a diversity of types, despite what my personal preference is because we have such a diversity of people. It doesn't make any sense to give somebody who has problems with alcohol sensitivity a tincture, because that will just set them right back path that they worked really hard to get away from. It also doesn't make sense to give somebody who has, say, type 2 diabetes a syrup. That's a heck of a lot of sugar to give them in one day. So we have to have a whole variety of different kinds of things to offer people so that they can get healthy on their terms. You'll notice here that we have lots and lots of nutritional supplements as well. And I know that there is a rumor out there that nutritional supplements aren't really needed, but for the kind of people that we serve, it is sorely needed. We have seen patients that have come in with scurvy. We've seen people come in with tremendous zinc deficiencies and magnesium deficiencies and we have to offer them what they need. There are people that are eating out of the garbage and sleeping under dumpsters or under trucks, and the type of stress that they have in their life means that they need that extra help. So we're really grateful to have all of these donations to send out to people. We also have over-the-counter medications that like ibuprofen, some of the NSAIDs that oftentimes are also available in prescription form, but as we're a Sunday clinic, people need that right now. They need, if the doctor gave them a prescription for 800 milligrams of ibuprofen, this is 200 milligrams. So just tell them you need to take 4 of them. That's very comfortable for our doctors, and it's also really nice because people that have pain problems, they have a safe and legal way of handling their pain that's within their comfort zone, and that helps us all, particularly if you keep in mind there is an opioid epidemic right now. So it seems like the more things that we have available to people for pain control, which is such a disabling thing, particularly for people that have to be moving all the time, then you can understand why people would choose some illicit forms of pain control. It makes complete sense. And to offer people a variety of different ways of dealing with their pain based on the type of pain they have, that makes us all a healthier and happier society. So again, we have a diversity of herbs and a diversity of forms because we have a diversity of patients. If you would like to support Occupy Medical, just go to our website, www.occupymedical.org.